Hi, folks. It's Marvin Music with MedicareSchool.com, and want to welcome you to this live event tonight. We're going to look at a very important topic, and that is dental and Medicare. And then I'm also going to take your questions. And so a couple things about questions. Our producer, Daniel, will go through the questions, and we'll try to get to as many as we can. If you have any questions really about Medicare, Social Security, I'm happy to field those questions. But be sure as you ask the questions to be concise, but not so concise that we can't understand what you're asking. Okay, so don't be so abbreviated where I don't understand the question. And so if you want to start putting those in, you can do so right now. But I want to talk about dental first, and then we'll start taking your questions. So first off, I want you to know that original traditional Medicare does not provide much in regards to dental care. They will cover medically necessary dental care, but that's it. So when it comes to your cleanings and extractions and fillings and root canals and implants and those kind of things, Medicare is not going to pay for any of that. Medicare pays for medically necessary situations. For instance, someone's going in for a kidney transplant. It's very important that their teeth are healthy. Oral health is important, so they'll do some work to make sure that's happening. If someone, let's say, has some type of a jaw cancer and there has to be some reconstruction of the jaw, well, that's going to affect the teeth, so the Medicare would pay for that type of thing. So again, very rare, pretty extreme type cases. So you can't look to Medicare to cover your normal things that you and I think about when it comes to dental. And so what I'm going to do is I'm going to explain two different systems that are available to you if you decide that you want dental. And the systems are really dependent upon how you plan to use your Medicare benefits. So if you decide to stay in the original Medicare A and B system where Medicare pays first, more than likely you're going to have a supplemental plan to fill in the gaps that Medicare does not cover. Remember, Medicare doesn't cover anything 100% other than preventive. So people that are in that A and B system get a supplemental plan, Medigap policy called, to cover those gaps. And so what happens then in that situation, if you use your Medicare that way, then we have to have a dental plan that is separate. We would refer to these as standalone dental plans. And so when you consider standalone dental plans, there's a couple things that are really, really important. Number one, there's a variety of carriers that offer these plans. So what you have to do as someone that's looking into this is, first off, I'd like to find out, what is your dentist like? What does your dentist take? Some dentists take nothing. Some dentists take lots of plans, and some will take a few plans. So if you do like your dentist and you don't want to have to change dentists, then it's always good to find out what the dentist likes and takes. Now, it could be that the plan the dentist likes, maybe you don't want that, or you can get a better plan. So as long as that plan is a dental plan is a PPO, you can really go to any dentist you want. Now, that dentist may not file the claims, but will typically give you the insurance paperwork, and then you can submit those for reimbursement. So again, I think you're safer with PPO plans regardless of the dentist that you would go to. So number one, what's your dentist take? Number two, what I'm looking at is, how is that plan going to work? What's it going to do? So let me just kind of give you a basic structure of dental plans. Number one, you'll see that there'll be always some preventive benefits within the dental plan. Usually a couple cleanings a year, a set of x-rays a year. And then after preventive, then we get into what we refer to as basic services. And these are your low-cost items, extractions and fillings, and things that don't cost a whole lot of money. So the third part is major services. Now that's going to be your root canals and your crowns, periodontal type work. So you have preventive, basic, and major. And so I share all that with you because each of those are going to be covered differently. The majority of plans will cover your preventive at 100% and normally immediately. Just as soon as you have a plan, you can normally get a cleaning and x-rays. That's preventive. Covered 100%, and usually there's no deductible that applies to that. The next set, basic services, again, the low-cost extractions, fillings, those kind of things, are normally covered at 80-20, meaning the plan you're on pays for 80% of the cost and you pay 20% of that. Now, there may be a small deductible that you have to pay first, but basically 80-20. Now, what happens is sometimes that basic coverage at 80-20 is immediate. And I'm going to show you how that works here in a minute. But immediate just simply means day one. You could have a small, simple service and plan pays 80, you pay 20. Then major services, is the 50-50. Sometimes maybe the plan pays 60 and you 40, but usually it's 50% out of your pocket, 50% by the plan. And that's major. And so the preventive is immediate. The basic can also be immediate, and maybe even the major. As long as you are losing some type of a dental coverage, it could be a work plan, it could be some other kind of individual plan. As long as we've had insurance, dental insurance, no longer than maybe 60 days, sometimes 30 days where it's lapsed, as long as we're coming off one plan into another, then we'll pretty much have immediate coverage. There's no waiting period. But sometimes if people have not had a plan and they want to add a plan, then the dental insurance companies say, well, you haven't had a plan, so therefore you may be coming in with some pre-existing conditions. So what they sometimes will do is they'll cover your preventive immediately, but they may have a 6-month waiting period on the basic services, and major services even a year. And the reason I'm sharing that with you, it's important that if you really do want dental coverage, the best time to get it is when you've lost some of the kind of other dental plan. We proved that you've had credible coverage, and normally, again, now you're going to get everything covered immediately. Otherwise, you could be subject to waiting periods. All right, so we find out what my dentist likes. We understand the kind of basics of the plan. The second issue is, what is the annual benefit of a plan? In other words, the preventive is usually covered separate, but all this stuff where you're spending money and the plan is spending money, then there's usually some kind of an annual limit, and that varies. Some plans are as low as $1,500 a year. Some are $3,000. We have one we write that's actually $10,000, which is great for implants. But the point is, find out that annual benefit. And if your teeth are really healthy and you rarely go to the dentist other than make cleanings, you may not need a real high annual benefit. But if you have teeth problems, it could be that you want a higher max annual benefit. Because once you've reached that max, then you're done for the year, and then of course it'll reset every year. So I'm paying attention to the percentage of coverage, 80-20, 50-50, when do I have the coverage, and how much is that dental plan going to pay. And so again, this is going to vary. And then, of course, the premiums. I can tell you the average premium right now on an average plan is going to be about $50 a month, give or take a few dollars. There are some that would be maybe $30, but they're probably only going to cover maybe cleanings and $1,000 worth of services a year. We have a plan we write right now that's $75, $80 a month, and it actually covers up to $10,000, and it really is primarily for people that have implants. But on that implant, we have a year waiting period, okay? So they're not going to cover it right out of the gate. I have lots of people who will call me and say, oh, I'm having all kinds of teeth problems, and I need this, I need that. And I'll ask them, well, you have dental insurance? No, I have never had it. And so what they think they can do is, write a check to a dental insurance company for $50 and go and get a root canal for, $1,500. That's not going to happen, folks. Insurance companies, they're not stupid. They're going to make sure you've been on that plan for a while before they're going to cover certain services. Unless, of course, you're coming off of another dental plan, and then they have to cover you because there's no waiting periods. All right? And so that's the situation. If you are an A and B and you have a supplemental plan, you're going to get a separate a dental plan. And again, there's all types of them to choose from, and these are the things you're looking at. Now, secondly and lastly, I want to talk about Advantage plans, because about half of all Americans today that are on Medicare are getting Advantage plans. So these are called C plans. These are replacement plans. So we enroll into Medicare A and B, but now we have a private health insurance company that's replacing our care, meaning they're going to manage our care instead of Medicare managing our care. And these are private health insurance companies, Aetna, United Healthcare, WellCare, Aetna. There are all kinds of carriers. They have these Advantage plans. And so the point is, right now, when you enroll into an Advantage plan, they're going to cover your medical side, the replacement of A and B, but then they also give you some additional, what we call perks, some additional kind of supplemental benefits. This would be vision and hearing, maybe a gym membership, possibly an over-the-counter card, could be a Part B give back. There's a variety of additional benefits, perks that they provide, and almost always they provide some type of a dental, I don't usually call it a plan, I call it more like a dental allowance. So when we have an Advantage plan, you're probably going to get some kind of a dental allowance. And they vary all over the board, all over the place. So a dental allowance today, minimum would be maybe $1,000 dental allowance, and that includes some cleanings, a little bit of comprehensive, meaning they'll cover up to $1,000. The thing you have to pay attention to on all these Advantage plans is, do you have to use a network dentist, a network provider? You have to make sure that your dentist takes it. If the dentist doesn't, you may need to change dentists. If you don't want to do that, then that benefit doesn't help you at all. But pay attention to the details of these Advantage plans on the dental allowance. Now, there are some that are $1,500. I looked at one today. It was $3,000, and frankly, it was very good. And so that plan had $3,000 worth of dental, and it included all services, preventive, basic, and major, and they covered the first $3,000, which was really awesome. It was zero copay on everything up to $3,000. That's a nice dental allowance. Now, again, we have to make sure that your dentist will take that, or you have to change dentist, but that's good. I would say on average right now, the dental plans are going to be around about $1,500. Now, what happens sometimes they will allow you to go out of the network, even if your dentist won't take it. If you go to that dentist and they provide the services, then what can happen is you pay the bill and then you submit those receipts to the Advantage plan, and they will reimburse you up to the dental allowance for that particular year, which is also fine. So if the dentist won't bill the Advantage plan or take it, you can still get your services there if that plan allows you to have this out-of-network benefit. And all I'm trying to teach you is that you have to pay attention on Advantage plans as to how you get to use that dental allowance. Does network matter? Does it include just just preventive, or does it include some other comprehensive services? And then you want to find out exactly how much of an annual benefit that you will have with that particular plan. And then, frankly, that's part of the thing that we look at. One of my calls today was with a gentleman that he has VA benefits, and so we did what's called an MA only plan with him. He can get his meds through the VA, and so we did an MA only plan, and he had a very attractive dental plan. That was important to him because he's going to get most of his care through the VA, but he wanted dental and he wanted gym membership, so we went with a Medicare Advantage only plan. And so it was a very, very attractive option for him. All right. And so when it comes to dental, just so you know, with our clientele, we have about half that get dental insurance, half that don't. Some people say, hey, my teeth are clean. Teeth are good. I just get cleanings and that's it. And you may not want a dental plan. Others have some issues. But I would say this to you. If it is affordable, I think it's good to have a dental plan because your oral health is so critical. And so you wouldn't want to, be neglectful with oral health because it's going to impact so many things. I could tell you story after story of people who neglected their teeth and had infection that spread to their sinuses or heart or their lungs and sometimes even to their brain and pass away. So dental insurance is good and very important. So if you work with us, we're happy to go through all those different options with you. Okay. And if you have any further questions, if I didn't cover something, feel free to ask during our Q&A time. Okay, Daniel. He's our producer. He's the one who's going to give me questions, and so let's get started. All right. Hi. Is there a non-Advantage dental plan that does not set rates for dental charges that are way lower than anything any dentist in that area? Oh, boy. A non-Advantage dental plan that does not set rates for dental charges that are way lower. Well, I don't know that. I do know that there are some discount programs out there that could be available, that could happen. But most of these plans do not, it's not going to be way lower. Yeah. I don't think so. Most everything in the dental plan business is going to be normal and customary for an area. So if so, I've never heard of it. So sorry about that. I'm not sure. All right, let's keep going. Considering your rowboat analogy, if UHC is the cruise line, would Cigna HCSC be the rowboat, and therefore I should offer UHC over Cigna through Cigna's cheaper? No, sir, or no, ma'am, whoever, Bob, not at all. Now, I know that and by the way, here's what he's talking about. When we buy a supplemental plan, we go into a group. And we know that typically the larger the group, the more stable the rates will be, because when you buy something plan, you're going this group. And so what's happening in the group is everyone pays their premium in, and then the company has to pay out claims. And so one of the ways that companies raise rates is when claims exceed premiums, they have the right to raise their rates as long as they, of course, get insurance commissioner of the state's approval. And so what he's asking here and talking about is, I use the illustration that when we buy a supplemental plan and we go into a group, I would rather be with a larger carrier that has a national, plans. So it's a larger group. Why? Because the impact of a cancer in the group and joint replacements is less impactful the bigger the group. Why? Because the risk is spread out to more policyholders in large groups, like he's mentioned, United Healthcare. And so we compare that to a small group, which sometimes would be a company that doesn't have as much of a market share, could be a regional carrier, and they have a small group. And so in that small group, if we start having lots of health claims, cancer, joint replacements and such, then those claims are not spread out to as many people. So those small groups tend to have more price increases. They feel the impact of the health issues going on. So we use the analogy of a regional carrier, small carrier, not a large market presence, is like being in an ocean in a canoe. Rowboat, he's saying, and in that canoe, you're going to feel the impact of every wave that hits you if you're in this ocean. So here's the rowboat, the canoe, and just getting smashed because of the waves. But if I'm in a large group, that's like being in a cruise ship in the ocean. You sometimes don't even know you're in the ocean. I've been on cruises, and that's what you feel at times. Why? Because it's a large vessel in a large body of water. You don't feel it. But if I'm in that little small body of water, I'm going to feel every single wave that hits. And so that's why we don't like small regional carriers. Now you're talking about Cigna. This situation here is HCSC is Healthcare Services Corporation, and they bought Cigna earlier this year, paid about $3.3 billion. They bought a cruise ship, okay? And it's going to continue to be a cruise ship. Yes, they're rebranding it. It's now called HealthSpring. But honestly, I see no problem at all going with them if you want to. I like United Healthcare. I mean, I like Aetna. I like Cigna, now to be HealthSpring. So I think all of those companies are going to be cruise ships. I really do. So I would not get off of my Cigna plan to go to United Healthcare thinking that I'm going to have more stable rates. Now, you could have, but it's not going to be because of the size, because again, HealthSpring, HCSC, now, the old Cigna is still going to be a very large block of business. So I think you're safe. All right, let's keep going. All right, if I choose to take Medicare at 65, how many months before I switch to Medicare do I need to stop HSA contributions, or can I contribute all the way up until I switch? Okay, so here's the way it goes. If you take Medicare at 65, and I mean Medicare A only or Medicare A and B, you can contribute to your HSA up to the month that you turn 65. So let's just say you turn 65 in July. And then you start your Medicare A only or A and B, then you can contribute all the way up to June. Now, it's prorated. So if you're maxing out, you do not want to max out any more than the monthly amount times 6, because once you've had your A, you can no longer put new money into your HSA. So that's taking Medicare at 65, even A only. Now, if you are going to put off taking anything, you're going to keep working, let's say for 2 more years. So let's say our birthday is July 1961, and we could have started Medicare at 65, but we don't. We start 2 years later, which would be July of 2028. And so that's when you want to start your Medicare, July of 2028. You won't wait till July to enroll. You will enroll probably 3 months in advance. So if I want to start July 2028, and I have nothing yet, I don't have A, I don't have B, I'm contributing to my HSA. So if I want to start July 28, I'll probably do that enrollment, let's say May, 2 months early. So the month I enroll, in my example, May, for a July start date, and now I'm 67 years old, they're going to backdate my A date from that May date. From when I enroll, they backdate 6 months. So as I talk about backdating A, they always go back 6 months or to 65, whatever's first. In my example, 65 is here a couple years ago. So for May, they're going to backdate A date. So they're going to go back this way. It'll be April, March, February, January, December, and then November. So you, in my example, would have a November 1 A date. They backdated it 6 months. So from 11/1, you should not be putting any more money into your HSA. Now, if you're putting in $50 a month, it doesn't matter. But if you're maxing out, you want to make sure that you only put in 10 months worth of your HSA contributions, because on that A date, you're no longer eligible to put money into an HSA. Now, I want to clarify something. For those of you that have a spouse that is older. Let's say that you are the one turning 65 and your spouse is 68 and has A only, but that spouse that has A only is covered by your employer plan and you're going to keep on working, okay? But you take nothing. But they have A only. As long as they're covered by that group plan and they're the spouse, you can continue to put your full family max into your HSA. It's kind of a little loophole. Otherwise, when we have A only or A and B, we can put no new money into our HSA. But with that one exception, it's the spouse covered by the other spouse's employer plan. All right, let's keep going. All right, I have Emeritus Dental and would like to keep for 2026. Just let it ride, and it will. Or do I need to do something? No, that Emeritus plan, by the way, I'm on that same plan. It is basically renews every month you pay your premium. Okay, so you don't have to renew it. It auto renews. Pay your premium. It's yours. Okay, you will not lose that. And again, like everything, Emeritus they do raise their rates occasionally. It's been very reasonable. I've been on it for years, but yeah, you don't have to renew it at all. All right. Hey, Marvin, I take it you enjoyed the Chiefs game on Monday night. I did. It was a very good game. Yeah, in fact, I had my wife and my son and daughter-in-law and my sister. So 5 tickets, and we had a blast. So we love the Chiefs. They're fun to watch. And it's real fun when they win, too. So, hey, we won. So thanks for asking. All right, the normal 6-month window for getting a gap policy without underwriting after signing up for Medicare B. During IEP, 63 days, if you sign up during SAP, it's just tighter. Okay, let's stop. Okay, so when you threw in the 63 days there, so let's talk about, Mike, the normal 6-month window for getting a gap policy without underwriting. That's right, it's tied to your B date, so let's make it simple. I turned 65 in January. Now I'll have all mine set up before then, but let's say my A and B card is January 1 of 2026, which it is. But what I can do, I can actually apply for a MedSup plan 3 to 6 months in advance. Now, my MedSup plan does not go into effect until my Medicare begins, but I do it in advance if you want. But officially, from the B date for now the next 6 months, in my example, my birthday is January, so January, February, March, April, May, June. So I'm still eligible to apply for a MedSup plan with no underwriting all the way up until June 30th, and then I have an effective date on July 1. I can do all that without any underwriting. So the 6 months is tied to the B date, and when you count your 6 months, be sure to count your birth month, okay? So that's that issue. And then you talk about 63 days you sign up during an SEP. Okay, so the way that works, it's the eligibility of an SEP is still 6 months of your B date if you're talking about supplemental plans. Okay, so that 63 days really only applies to drug plans. So if I don't have a drug plan, once I stop Medicare and I'm coming off of a group plan, I have 63 days to pick up a drug plan. So 63 days truly has nothing at all to do with your Medicare, because here's what happens. To get enrolled in Medicare B, you actually, once you've lost your employer plan, let's say you're 67 and you've had coverage back to 65, you actually have 8 months to come into Medicare. Now, I would never use the 8 months at all because you're on COBRA and COBRA only pays second. So you want to start your Medicare when you're using an SEP, you want to do that in advance of retirement. And so I'm just saying 63 days has nothing to do with it. I promise you it doesn't, other than for drug plans. Okay, let's keep going. All right. Hi, I'm Carmen, New Jersey. I have a dental insurance that started 7/1. Can I cancel it and add myself to my husband's insurance in 2026 since he's still working? Absolutely. Yeah. In fact, we tell people if you have a spouse that has a good dental plan, group plan, or you can even COBRA at times, we encourage people to stay on those plans so you can. So your dental insurance, if it's a standalone dental plan, meaning it's just a separate plan, yeah, I think you can cancel those at any time. I've never heard differently. And if I'm wrong about that, I'm really sorry. But yeah, so whenever your husband, his company is going through the open enrollment season, then he should be able to add you, and it probably goes into effect 1/1 of 2026. So what I also would do, Carmen, is call whoever you have, your dental insurance company, and call them and say, it's possible for me to go on my husband's group plan and it's better or cheaper or whatever, and say, how do I go about canceling this dental plan? And they'll tell you if there's some kind of a time frame involved there, okay? Because there's a lot of different companies, and so I don't want to misspeak here, but that's what I would do. Double check to make sure you can. What's the process? Normally it's verbally over the phone at any time. Okay, good question though. Okay, when will our Plan G providers give us the new monthly charge in case we want to change providers? I called them this week and they could, yeah. Okay, a great question, and we are getting this a lot at this time. So folks, here's what you got to realize about supplemental plans. Supplemental plans have nothing at all to do with this time of the year. October 15th to December 7th is the period of time for changing Advantage plans and prescription drug plans. And so supplemental plans, they're lifetime, so you never have to change them at all. But as far as price changes, increases to your premium, what that is normally tied to is tied to the anniversary of your policy. So let's just say you started a policy 7/1 this year. Well, you're not going to know anything about your price increase until 1 or 2 months before 7/1 of 2026. So it's on the anniversary of the policy that your price comes up, for renewal. And you normally get notified of that price change about 30 to 60 days in advance. So if your policy happens to be renewing in January, well, you're going to hear now, November range. They're going to let you know. But that's just coincidental. It's only happening because, again, you're within 30 to 60 days, the anniversary of the policy. And we don't know either. People call and say, hey, can you tell us? We don't know. Because remember, supplemental plans are not tied to this open enrollment season. Really, the only thing, folks, that matters if you're on a supplemental plan right now is that you're making sure you're on the right drug plan, because those are switching for sure. Those are annual events, but nothing with your supplemental plan. And the other thing that would matter if you're on a supplemental plan is if you're making the decision to move to an Advantage plan. This is the only time that you do that. But as far as the sup by itself, if you're going to keep it, you're not going to know anything about it until anniversary. Okay. Great question, though. Let's keep going. An appointment today to speak to your representative. They never called. I'm very disappointed. And Tim, I am also. So I tell you what, let's do this. If you can somehow reach out to him, Tim, do me a favor. I'm gonna give you our number, and I am really, really sorry that happened to you. Okay, Tim, I'm gonna give you a number to call. Let me give it to you in just 1 second. And I'm really, really sorry that happened. I hate that. So, do we have his email address? Oh boy. Okay, Tim, here's, I'm sorry, everyone hang on. This is important. Okay, here's what you're going to do. You're going to call this lady, please. And she may be gone for the day, but please call her. Try it right now. This is her direct line to her desk, 913-391-6246. 913-391-6246. Let her know what happened. Her name is Christina, and she will take care of you. And again, she may already be gone for the day, but call in the morning, please. She is a pro, and my sincere apologies for that. I will tell you that sometimes when we reach out to people, I don't know, it could have been phone system. I just don't know. But Tim, forgive me, that happened. I hate that. But anyways, please reach out to Christina, and I can assure you she will take care of you tomorrow. All right, next. Okay, can you speak briefly about what, if any, vision assistance Medicare offers? Okay, well, first off, when it comes to original Medicare A and B, it is excellent vision coverage. And here's what I want you to learn. There's two things only that A and B will not cover for vision. They will not cover non-preventive eye exams, non-medically necessary eye exams, which means preventive eye exams. Let me say it again. I kind of blew that. Medicare will not cover preventive eye exams, but they will cover medically necessary eye exams. They're covered. The second thing Medicare will not cover would be any eyewear. This would be glasses or contact lenses, except after cataract surgery. So all I'm trying to teach you all, that's the two things that original Medicare A and B will not cover. Preventive eye exams and eyewear. Okay, that'd be the only reason you'd get a vision plan. If you wear glasses, you can get a vision plan. Vision add-ons right now are normally about $15, $16, very inexpensive. Okay, but if I have nothing, then, and I just have A and B in my supplemental plan, then I have excellent coverage by Medicare. They will cover cataract surgery, they will cover glaucoma issues, they will cover macular degeneration, they cover the form when you have to have shots in the eyes, they cover that. So truly, folks, original Medicare A and B in your sup, great coverage for vision. I had a detached retina. I'm not on Medicare yet, but I had a detached retina. And if that would have happened while I was on Medicare, everything would have been covered, okay? I'd had to meet, a small deductible, but everything else covered well, okay? So just know it's just very good. Now, when it comes to Advantage plans, what they do is they will throw in a perk for vision. And that is they will give you a vision allowance, and they vary, sometimes $100, $150 a year for eyewear. One company is $250 every 2 years for eyewear, and then they will give you a basic eye exam at no cost. Okay, but if you do add-ons and want certain things, then there's an upcharge for that. But again, original Medicare is great. It really, really is. So hope that helps. Okay, if you want a vision plan, they're very inexpensive. You can do an iMed network plan, $15, $16 a month. VSP typically $18, $20 a month. Okay, and I'd only get that if I had glasses. That's it, because otherwise everything else is covered by Medicare. Next. All right, will the plan cover pre-existing dental conditions, like if I need a root canal before I get coverage? Well, that's an interesting question. So I will tell you this, if it was definitely a known pre-existing condition, I think that claim could possibly be challenged. I do. Now, if you're coming off of a work plan, like a dental plan from work, and you immediately go into a plan, then they will cover that. Okay, yeah, they'll cover the pre-existing conditions. But if you've never had insurance and now you're going to come in and write a check for 1 month's premium and it's pre-existing, I would not count on that being covered. I wouldn't. Okay, that's why I was saying earlier, if you're on a group plan, that the insurance company's philosophy is if you have a dental plan, you're probably not neglecting your teeth. You're probably staying on top of things, so they're willing to take the risk by going ahead and giving you immediate coverage. I do know that there are some plans that have, they call it a, well, it's basically you have a, well, I don't want to get into that. It has something to do with like a missing tooth kind of issue. So, okay, I'm not going to address that now because I can't give you real clarity on every plan in that regard. So let's keep going, Daniel. All right, I have an in plan where I have copays. Do the copays go towards my B deductible? No. So what would happen is, not at all, your B deductible will be that first $200 this year, first $257 of any of the B services. And so let's say you go in for an MRI, that's your first claim of the year, you're going to pay $257. Or if you go in for cataract surgery, you're going to pay the first $257. And then after that deductible is met, regardless of the services, then every time you see a doctor, you're subject to a copay of up to $20. Okay. Now let's say that your very first claim was a doctor's visit, and that doctor's visit was $120. You're going to pay that. Okay. You don't pay the $20, you just pay for the full bill. And then you have another one, $120. Again, you're going to pay that full $120. We're at $240. So we're getting close to meeting that deductible. Then once it's satisfied, then that's when the $20 copays begin. All right, can you explain the difference between dental insurance and dental savings plans? I can't. I'm not familiar with a dental savings plan other than it could be that you may be referring to something that one of the carrier provides that is dental savings, meaning you enroll into a plan, there may be zero premium or low premium, and then you go to a dentist that's under contract with that dental savings plan, and they agree to give you services at a certain cost. It's been discounted. That's what I maybe think you mean. And so those are typically zero premium, so that would be a difference because the dental plan is going to cost you, and then it would just simply be a discount on certain services. When it comes to dental insurance, they have already determined that if it's a major service, it's going to be split 50-50. It's not a discount. A basic service is 80-20, again, not discounted. So that would be the difference. So they take the normal and customary, and the insurance plan pays a certain percentage. With dental savings plans, it would be more of, you get this, root canal at 20% off, or you get this implant for, 50% off. That's what I think you're referring to. Okay. Oh, yeah. Oh, I'm sorry. I should have mentioned that. Yeah, we write a variety of dental plans. In fact, almost everyone that we talk with, we talk to them about dental. And as I said, half get dental plans, half don't. Some people just self-insure. They certainly do that. So we write them, all day long, all over the country, lots of them. So we definitely write dental plans. We don't write dental savings plans. Now, if it comes with like a Met Sup or something, then we'd write that. But typically dental plans are separate. And we write them, and we help you shop those too to make sure we match one for you. Okay?
Even if it's dental plan only.
Would you say?
Even if it's just for a dental plan only.
Oh, a dental plan only. Well, yeah, call in, the 800 number on the screen, and that could be a possibility. Okay, yeah, we may write some dental plans only. So if you want to call in, the receptionist team will tell you about that, and we probably do. Usually we're dealing with people that are, doing Med Sups or Medicare Advantage, but call in and find out. I'd be happy to help if we do. All right, can I get a dental plan anytime, or do I have to wait for the new year? No, you can add a dental plan anytime. The only way you'd be limited is if you have an Advantage plan, then that dental allowance is embedded within that. So then you, of course, have to do it during this time of the year, October 15th to December 7th, to get dental. But if it's just a standalone dental plan, add it anytime you want to. But remember what I said, that if you're coming off a group plan, work plan, you or your spouses, if you enroll into a dental plan, some within 30 days, some will go up to 60 days, then you don't have waiting periods. You will be, immediately covered. All right, but you can add them anytime, no problem at all. All right, my health was okay in 2024, but a few months ago I have had heart problems. I have Plan G, so will they still cover me since I did? Absolutely. Marjorie, your supplemental plan, I don't care who you have. Your G plan is for life. You will never lose that plan, ever. I dealt with a lady today that called me, and she was concerned about the same thing, and she has COPD. She'll never lose her plan. All you have to do is pay the premium. And folks, that's one of the beauties of supplemental plans. They are truly lifetime. They can't be canceled because you have health problems. They can't be canceled because of your age. They can't be canceled because you relocate. You take your supplemental plan from one state to another. It's always your plan as long as you pay the premium. So don't worry about it, Marjorie. You got great coverage, and you always will have. Okay, does California really allow you to move from Advantage plan to supplemental plan after the initial 12 months without underwriting via the birthday rule? Grok AI says yes. One broker says yes. Others say seldom. No. I too believe that California would allow that to happen. Okay. Without underwriting, but I'm not sure. I guess I didn't see it as tied to the birthday rule, but maybe it is. Can you check on that, Daniel? Yeah. So, and for those of you who wouldn't be familiar with this, Advantage plans, when you start on an Advantage plan, you typically have a year trial right. And that means that I'm turning 65, I started on Medicare and took an Advantage plan. For the first 12 months, if I get off that plan, I can return back to original Medicare, get a supplemental plan with no underwriting involved. Now, if I'm on the Advantage plan longer than a year, and I want to move back to original Medicare and get a sup, now I have to medically qualify. But there are a few states who actually have waived that, or instead of 1 year, they may make it 3 years. So do you see anything, Daniel, at all on that?
Can't find anything.
Okay.
Okay,
yeah, that's and honestly, I've never had that question about California after 1 year. I would tell you this: birthday rule has to do with those people that are on Medicare supplemental plans, and in California, I think it's like 30 days before your birthday and 60 or 90 days after, you can move like to less. So you can move from a G to a G or G to an N with no underwriting. So that's the birthday rule. So that they're including the birthday rule as part of their Advantage plan, I would doubt that. What I was trying to see, Daniel, is if in California, maybe they would have an extended trial right.
I'm not seeing.
Yeah. Okay. So for now, I don't know. Sorry about that. You stumped Marvin for sure. We need to find that one out. Okay, here we go. Are you allowed to have an Advantage plan with dental and a separate dental plan both work together? Is that possible? Or is it, well, no, you can definitely have those. So it is possible. So what would happen is when you go to the dentist, I think what would happen is your Advantage plan is going to pay first, and then your additional one is going to pay second. I don't think that you get to decide that. There's the rules are maybe the dentist will decide that or the plans do it. But I think the Advantage pays first, and then your other one pays second. So it's fine. Hey, I've heard of people having 3 dental plans because they only cover so much in amount. So you definitely can have more than one plan. The question I can't be confident is which one pays first. I know that if you have a group plan, it always pays first, and then anything supplemental after that. But they'll coordinate those benefits. Those insurance companies will work that out. All right, let's keep going. I'm sorry, I just logged in. I do not have an HSA contribution. Does it affect my... No. FSA, flexible spending accounts, there's no really, the tax advantage for them is, you can deduct it, but that doesn't carry over into future years. HSA contributions build and continue on. So you can continue to contribute to your FSA if you have A only or A and B, doesn't matter at all. It's HSAs that have the restrictions. All right, hello Marvin, I'm Medicare and B, recently started G with one of the reps. It seems that I also need vision and dental. What I have to do now since they're not covered by Plan G. Okay, well, you're a client. Just call in, please, and tell the receptionist that you're our client and you need to add a dental vision plan to your coverage, and they will transfer you to the right team, okay? They will take care of that. So just call in, please. Marvin, if your professional opinion, most insurance coverage are attained age rating, which means dual increases annually. Do you favor issue and community age if the carrier is larger? Well, I would, first off, you and I do not normally get to decide whether we're going to be covered by issue age, community, or attained age. We usually don't get to decide that. The insurance commissioners normally dictate that. And when they don't dictate that, almost all carriers are going to be attained age. All right, so so you're asking me which means dual increase annually. So first off, here's what I favor. I see where you're coming from. You're saying if the carrier is larger, then I would probably favor, I don't know, I like attained age. I just do. I can see what you're getting at here. I never would favor community age. And for those of you that don't know what we're talking about, community age means that you're in a state that says that everyone that lives in that community, which could be multiple zip codes, could be the whole state, but everyone gets the same rate on their MedSup plan, regardless of age and regardless of gender. Okay? The only thing that dictates would be the location. So the 85-year-old person pays the same premium as the 65-year-old, which means the 85-year-old is getting a bargain, the 65-year-old is paying a lot extra. That's community rated. And if I'm not mistaken, I think there's 8 states in the country that demand community rating. I could be wrong on that, but there's just a handful. Issue age that this person's talking about, issue age means that this is a state, and right now, I think there's only 4 states that mandate issue age. Florida does, Georgia does, Missouri does. I think there's one other, but issue age means that when you come into the MedSup group, your rate is based upon your age. But after that, future price increases can never occur because of age, but they still occur because the whole group goes up. Okay, so attained age means that every year you're older. So if I come in at 65, let's say my rate's $130. When I'm 66, it's going to go up probably $4 or $5. And then when I'm 67, it's going to go up $4 or $5. So attained age always starts the lowest, and then little by little it raises up because of age. The concept and philosophy is, and this is what I buy into, is that by allowing the carrier to raise the rates a little bit every year, it should offset the size, the amount, or the drasticness of group increases. That's the philosophy, and I think that's true. So again, that's why I look at the group. So what you're saying, if we're comparing apples to apples, we have these two large groups. Which would I like the best? For me, I'd still like attained age because I know it started lower. If you think it's issued, that's fine. I don't think that's wrong or crazy, but I still would favor attained age policies. Now, I think it does matter that we realize that when we come into this group, that all the groups go up because of these group increases, which only happen when premiums do not cover claims. So once claims exceed premiums, then all of them have the right to raise rates once they get the insurance commissioner's approval. Because sometimes people will say, well, issue age doesn't go up after the policy's been issued. Yes, it does. It's not going to go up every year because of age, but you still are going to go up because of group increases. So community, issue age, and attained age all go up because of group. Attained age is the only one that goes up because of age, but again, they start much lower. All right, I rambled on too much about that. Let's keep going. I was going to get Aflac for my supplemental plan instead of United Healthcare. What do you think? Aflac compares to United Healthcare. Well, right now, if it were me, if I could see some kind of a sizable difference between the Aflac rate and the United Healthcare rate, I probably would go with Aflac. The Aflac block is actually managed by Aetna. Aflac, I don't think they're going anywhere. We have seen them to be, pretty stable with their rates, so I'm not afraid of that. Now, with United Healthcare, they of course, one out of all three people on Medicare have some type of a United Healthcare plan, supplemental or Advantage. So they're very large. Another thing about United Healthcare is in some of their plans, they do provide a gym membership. So I've had this happen. Yesterday, I had a guy that was with United Healthcare. His rate had bumped up more than what he liked, but he goes to a gym that's covered by United Healthcare's Renew Active, and his gym membership literally is $170 a month. I had a lady a couple weeks ago, her gym membership was $110 a month, covered by United Healthcare. So I would bring that in the equation as well. Because sometimes, 20 or $30 difference between the rates, if they cover gym and you use it, that's still a pretty good deal. But am I afraid of Aflac? No. I like them. I like United Healthcare as well. They just haven't been really very competitive lately as much as Aflac has. So hope that answered your question. What do you think? So I think Aflac is fine. I think United Healthcare is fine as well. But I'm looking for stability, and I think both of those are going to give you some good hope of future stability. Okay? All right. I'm 72, still working, still have company health insurance, 500 employees or more. Will I be penalized if I don't take B now, or do I have to take B and also get a Medigap program even though I'm still working? No. Kenneth, keep working. If you're on a group plan this size and it's attractive, you don't have to do anything. Now, what I do know about you is I know you have A only because you're 72, and I know you're taking Social Security. We never take Social Security beyond age 70, so you have A only. So don't take B. You're fine. The key to this is this. When we come into Medicare at your age, 74, 75, I brought a lady in that was 79, husband 83. The key to this is we have to prove that you've had credible coverage for every single month, all the way back to 65. So either we have to have employment provided insurance or we got to be on Medicare. COBRA doesn't count. And for those of you that are watching there and keep working, just remember, if you keep working, you don't have to have anything with Medicare A or B as long as the group has 20 or more employees on the payroll. Nothing. But if you change jobs and you're going to be without a group insurance, active employment insurance for a month or two as you change jobs, you got to go on Medicare because you'll be covered by COBRA, but it's not credible coverage. So when you want to get into Medicare at a later date, you just shot yourself in the foot because now we can't prove every single month you've had insurance through an employer plan. Now, by the way, that doesn't have to be your plan. It could be your spouse's plan. But every single month back to 65, that's the key coming in. So, Kenneth, that's all you have to make sure of. Stay on the group plan, keep group insurance, and you'll be fine. And what I tell people to do is this. Once you set that retirement date, let's say, Kenneth, you're going to work to 75. What I would do is 3 months before you know you're going to retire and lose the group plan, that's when you want to call us or someone that's going to help you that can walk you through the process because we got additional paperwork involved. You can't do it 4 months, 5 months in advance because Social Security will not process that application for Medicare. That's who does this. So about 90-day window is the perfect window to get everything set up, and we call this the SEP. It stands for Special Enrollment Period. So that's what you're talking about. So you are fine, sir. You are.
Okay, here's a follow-up.
All righty. Medicare school pushes Medicare Advantage? No way. Now, frankly, we don't push anything. If we were accused of pushing something, we're going to push med subs, okay? I'm telling you, 75% of our clients have Medicare supplemental plans, 25% have Medicare Advantage plans, so we don't push them. Now, I will tell you this. If someone cannot afford a Medicare supplemental plan, then we would encourage them to get an Advantage plan. Listen, I have trained every single agent that works for a company, and we're not known for being pushy. When we want to write business, we want to help people for sure, but we do not push plans. We just don't. Okay, now I will tell you why most people push Advantage, because we make twice the commission. We make half the commission on supplemental plans, half, as we do on an Advantage, and we get paid 6-year residual on a Medicare supplemental plan. We get lifetime residual on Advantage plans. That's why agents push them. They don't push them because they're better coverage. They push them because they're better commissions. Now, do we write them? Sure, we write them. Why? Because not everyone can afford or doesn't want to afford a supplemental plan. Then we take the next best option, which is an Advantage plan. The worst option is to have A and B only. So I may be accused of pushing supplemental plans or maybe Advantage if you can't afford that sup. All right? Appreciate the comment, though. Let's keep going. All right, gosh, did I hear you have someone to help us through this? It's time for me. Misty, yeah, we have lots of someones that would be delighted to help you, trained by me, I promise you, that will care about you and will give you the time that you need to make sure you're making the right decision. So call in, let us know what you want, and Misty will help you with Medicare A and B. If you want to start Social Security at the same time, we can tie that into the same application, and then we'll look at all your different plan options. You can compare them, you make the choice, and we serve then as your Medicare broker. Here's the good thing, too. We don't cost you a penny. And no agent does, whether you use us or Joe Blow across the street. Agents are not paid by you. We're paid by the insurance companies. They pay us a commission. And the price is all the same. Get this. Had a lady call me, less than a week ago, and she said, Marvin, your rates are higher than what I saw online. And she was 70 years old, getting ready to retire, and she thought our rates were higher. And I knew exactly what happened. I said, here's what's happened. You went to a site, and they're quoting you a 65-year-old rate, and you're 70 years old. And so I said, let me tell you the actual rates, and what yours would be at 70. You're not going to get this 65-year-old rate. And I said, go ahead and give me the prices of what you were told. I wrote them down, and I told her what she actually going to be charged. And then I went to the website, and that's exactly what happened. Now, I'm not mocking this lady. She was sweet and kind. She just didn't know. But they were quoting 65-year-old rates. She's 70. And so to the penny, exactly what I quoted her was exactly the rate that she got. Okay? So we don't set the rates. That's the whole point. No matter what agent you use, we don't set prices. Insurance companies do, and there's not varied prices. Now, I will tell you this. There are sometimes I've caught agents doing this. They may know you're a smoker, and if you're in an area where that matters, they may quote you a non-tobacco rate and lie about it. I'm not going to do that. Usually, tobacco doesn't matter when you're first going on Medicare, but when you're switching, it does. And sometimes agents are dishonest, and they'll give a smoker a non-tobacco rate. Listen, if they do that, they haven't helped you. Why? Because if you have some kind of a smoking-related problem and comes in for a claim, they find out you're a smoker, they have every right to deny that claim, I think, for the first year or two. So that's crazy. It's not worth it. That's foolish. All right, let's keep going. I have a timing issue, neat guides. I turned 65 mid-May. Good. Now I'm applying for survivor's benefit, maybe February. I was told to let Social Security know when I want the checks to begin. What do I tell them? Okay. So here's the issue. Of course, I don't know everything about your situation, but when it comes to survivor's benefit, I want to make sure you know that if you're still working, I know you're not yet full retirement age. You won't be full retirement age until May of 2028. So if you take survivor's benefit, widow or widower, then you are still going to be subject to the earnings test. So make sure you're aware of that. If you're still working and you're making above, right now it's $23,400 a year, you're going to be penalized even on your survivor benefit. I hate that rule, but it is true. But if you're no longer working, and then there's no earnings test if you got rental income and investment income and all that. That's not tested, just working wages. So I want to make sure you know about that. And so what they're saying about your check is this. Let's say that let's say I apply for Social Security today, October, and I want to start my Social Security benefits when I turn 65 in January. So I'll have a schedule, a calendar. They say when you want to start. So let's say I apply today and I say I want to start my benefits in January. Then I will get my first check in February, because Social Security benefits, whether it's survivor, retirement, spousal, doesn't matter, are always paid 1 month in arrears. Okay? And so my point is, that's why they're asking you when you want your first check, because then they're gonna on the calendar gonna say, okay, if you want your first check in, let's say February, then you would want to say, I want to start my benefits in January. If you want your first check in January, you want to make sure you tell the calendar on the calendar, you say, I want to start my benefits in December. So that's what they're referring to. Okay? Yeah, 1 month in arrears always. All right, I own a small business, provide health insurance to my 4 employees. My current insurance becomes my supplemental plan. Should I shop other supplemental plans? How will that affect my employees? Okay, well, I'm assuming you know, great question and scenario. You know that you have to enroll into A and B. And what you're saying is that your group plan is going to pay second to Medicare, and that's true. What I would do is this. I mean, hey, I'm one of 4 owners in this company. We pay for our employees' insurance, not their spouses, but theirs. And so I know what it costs us. I think it's about $1,200 a month average. So you can get, what I would do is, if you can, if you don't have to be part of the group plan, then just get a normal supplemental plan. Get a Plan G. It's almost 100% coverage, or a Plan N, very, very good coverage as well, and get a drug plan. And so if you can come off of your own plan as the owner of the company and still cover your employees, that's going to be the best deal for you financially. That's what I would do. And your issue really is also, you have to have A and B, because Medicare pays first, your group plan pays second. And so now you can select any plan you want because you're within 6 months of your B date. But after that, you wouldn't be able to select but one plan. Okay, so you're in a period of time where you can have anything you want, but that could be restricted down the road without underwriting. Okay, so just keep that in mind. So should I shop other supplemental plans? The answer is yes. And I don't think it'll affect your employees, but you need to call your administrator or your whoever's helped you with the group plan and ask them if you can come off. I think you can. I really do. And hopefully that's the case. I've never seen it where the owner had to be on the plan. You're providing that for your employees, so they're covering 4, they ought to be able to cover 3 at a reduced premium. All right, I'm hearing conflicting information. If your C plan closes down, can you buy any sup plan offered in your state FGN? I'm hearing only F and G. Okay, William, again, thanks for the question. Here's my opinion, and I think I'm right on this. The way it works, and by the way, y'all, there could be some exception with states. I would assume maybe what I'm getting ready to teach you may not apply to New York, Connecticut, Massachusetts, maybe Minnesota. Okay, but I've been reading some things. Minnesota's kind of delaying some of their stuff until July of 2026. So what I do know, I'm going to answer your question, but keep in mind, New York, Connecticut, Massachusetts could be different. So all the other states, here's what I know. When you lose your Advantage plan due to plan termination, you have the right to return back to original Medicare and get a supplemental plan, guaranteed issue, no underwriting. And the guaranteed issue products are this. If you started Medicare, just look at your card. If you started Medicare before 1/1/2020, your guaranteed issue product is an F plan. If you started Medicare after 1/1/2020, your guaranteed issue product is a G plan. Okay? Now, if you want an N or you want some other kind of letter, you can still get those, but now you have to go through underwriting. So my plan terms, I can get us up, no underwriting, but it's going to be F or B or G. That's what I believe to be true, William. Okay? All right. And it's not company basis. I think it's more state-to-state basis, frankly. Let's keep going. If enough time has passed after you've been diagnosed, treated for cancer, are you now cancer-free and past medical underwriting? Would you also qualify for a cancer indemnity plan going forward? Oh, wow. That's interesting. Well, I can definitely speak to supplemental plans about this. Normally, we have to be cancer-free and treatment-free for minimum of 24 months. Some companies ask about cancer in the last 36 months. Okay, so if that cancer is, if you're a company that only has 24 months or 36 months, if it was prior to that, you are fine. Cancer-free, treatment-free. Got that? So that's for sure. Now, when it comes to cancer indemnity policies, I don't know all the questions there. For some reason, I was thinking it was in the last 5 years. But if you will call in, we write those all the time. I mean, I don't, because I don't write a lot of business anymore. I help run our company. But the point is, if you'll call in, we can definitely let you know what the look back is on a cancer plan. But I was thinking it was 5 years. Subs 2 to 3. Okay, keep going. Okay, Social Security for retirement age is January 2026. Already applied and approved for benefits to start. Then I plan to work all of 2026. Will Social Security recalculate my benefit with 2025 and 2026 income? Okay, I believe yes. So I think even after you, if you continue to work and you have some higher income years that would knock out the lower income years, because they're always looking at the top 35 years, and they will recalculate your primary insurance amount. So the point is, if you do have some higher income years, I am pretty sure that will then be recalculated. And that 25, 26 income could then benefit you. And if you want to double check on that, you can always just call a local Social Security office, but I'm pretty sure that's the way it works. I do know that until we decide to start taking benefits, once we hit 62, they calculate our primary insurance amount and then recalculate it every year. So as we keep working and we have cost of living adjustments, that happens. So I believe they continue to do so while you're still working. Okay, they'll just knock out lower income years. Okay, let's keep going. Daniel, we need to confirm that one of these days. Does your company cover supplemental vision and dental plans in New Jersey? Yes, we do. So if you'll call in and tell the switchboard what you want, then we can talk to you about. I know there's been some disruption in that state, but I still think there's some decent options available. So please call in that 800 number, and we're open right now, folks. Let's see, at 6 o'clock Central Time, we're open until 7 tonight. We're open 7 a.m. to 7 p.m. Monday to Thursday, and then 7 a.m. to 6 p.m. on Fridays. So you can call in right now, and if there's an agent available, then they'll transfer the call. If not, they'll take a message, and we'll get back with you. Okay, next. I have Cigna Medical Supplemental Plan G. I need an appointment with my doctor for my annual physical exam. The group accepts Medicare, but they wouldn't take Cigna MedSup G. Okay, let me tell you what's happened. One of two things. Number one, more than likely, you have called a provider and someone answered the phone that didn't, they're rookies. Many times, folks, when you, on a supplemental plan, you don't even have to ask them if they take your supplemental plan. Because if they take your original Medicare, they have to take your supplemental plan. So the receptionist, whoever you talk to, confused, and again, they just don't know that what they're thinking, that you're on a Cigna Advantage plan. And if they're rookies, they don't understand the difference. Okay? That's more than likely what's happened. But occasionally what happened, it could be that your doctor is owned by an insurance company and the Advantage system. There are some docs in the market today that only take Advantage plans because they're owned by the Advantage companies. Okay? And they won't take anything but the Advantage because, again, they're owned by them. But that's still very, very rare. More than likely, you talk to a rookie who didn't understand, or it's the other option, which is doubtful. But folks, that's why we tell our clients, when you call your provider, you don't have to ask them. If you're on a supplemental plan, don't even ask them if they take it. Say, do you take original Medicare? And if they do, they're going to take your supplemental plan. Unless, of course, they're owned by the Advantage company. Okay, keep going. Can HSA funds be used for Part B premium or Part D IRMA or the supplemental or dental premiums? Okay, HSA funds can be used for all of those, but not supplemental premiums. Okay, you can be reimbursed on your Part B premium for sure. I've never had anyone ask me about being reimbursed by a D IRMA. I assume so because it's part of the Medicare B. It's just an IRMA. I know you can be reimbursed for the B and for the dental premiums, yes, just not supplemental plans. That's it. Qualifying, they're called qualified medical expenses. And SUPs are not, everything else is. All right, what happens if I miss a G plan monthly payment? For any reason, it would be possible to reestablish a G plan. Well, here's the way it works. For sure, you have 30 days of grace. Now, I have seen carriers reinstate your policy if it wasn't too long. Now, sometimes to reinstate it, they're going to go through the health questions. But I have seen them 30 to 60 days, give a little leniency. But I can assure you, if it's more than 90 days, now you can always call and ask, but if it's more than 90 days, they're probably not going to do it without asking you the underwriting questions. Okay, 30 days, no problem. 60 days, maybe. 90, doubtful. All right, that's why we tell people to be sure you pay your premiums through a bank draft. Pay them through a bank draft. Don't be on a direct bill, especially when you move and you don't update your bank records. That can be a problem as well. So be sure that you pay through a bank draft and keep them up to date on that account number so your policy doesn't lapse. And sad, I've had people in my career that moved, didn't update their bank records, company went into draft, money wasn't there, they moved, the mail caught up with them, too late. And they couldn't medically qualify, had to get an Advantage plan. Could not keep their supplemental plan. That's sad. All right, anybody else? Okay, I have a PDP plan, no deductible on their site. It says the new deductible on my Tier 3 prescriptions will have a $130 deductible. I know what plan you're on. Is that for each Tier 3 drug or just one charge for all three prescriptions? No, it's a $130 annual deductible. Okay, I think that's what you're asking me. It wouldn't be for each. No, it's annual. So your first fill is going to definitely take care of that for sure. And so I know that plan is, a healthcare plan. You're probably paying $120, $140, $50 a month for that plan. But it's a very, very good formulary. Yeah, they're the only ones this year that had a $130 deductible. Humana may have also, but let's keep going. Never mind. But yeah, it's an annual deductible, not each drug. All right. Been on Cobra for 3 months. Is that going to hurt me? Okay. Well, it just depends. If you're after 65 and you are going to continue to work past 65, then it's definitely going to hurt you. Now, another thing, Judy, if you're still within 6 months of your original B date, when you could have been eligible for Medicare, you're fine with that situation. Now, if you've been on Cobra prior to 65, you're not hurt at all, okay? The only people that are hurt by being on Cobra are those that want to start Medicare after 65 and they didn't have anything but maybe only. They didn't have B. That's a problem, all right? Now, let's suppose, though, that you are 67. Well, Judy, I would love to know how old you are in your situation, because it could be that if you worked past 65 and then you lost your job and went on Cobra, you're still fine, because if I keep working past 65, let's say I'm 65 in 1 month, then I now have 8 more months to come into Medicare with no penalty. So then the Cobra didn't hurt you. So that's a loaded question. So you could be hurt, but you may not be. I just have to know more. So why don't you do this, Judy? Call in tomorrow or now and tell the agent your situation, and they'll let you know whether you're in trouble or not, okay? Because you may not be. Yeah, I don't know enough to know for sure, but call in. Our agents know that stuff, and we'll tell you the truth. Let's keep going. All right, my wife turned 65, 5/1/2026. When she enrolls in February, does her coverage go into effect 4/1? Yes. Yeah. And what he's saying here, what Jeff's saying is that when your birthday is on the first day of the month, folks, your coverage always starts the prior month. So birthday's 5/1, she will start 4/1. In fact, she can even, enroll, if she's self-enrolling, she can even enroll in January, because her coverage is going to start 4/1. So she can start enrolling January 1, 3 months before. So January, February, March starts her 4/1. And February's fine too. But yes, birthday on the 1st, you start the previous month. Birthday on the 2nd day thereafter, you start your birth month. All right, Marvin and his team do a great job. Thanks to him and Medicare School. I like to grade 7 in. Plan about a year ago and retired. Well, hey, John, thank you for the encouragement. I'm glad you had a good experience, and we truly, truly appreciate the opportunity to serve as your Medicare broker. Thanks a lot. All right, if you're on a plan G, willing to pay a higher deductible, which deductible? Can you actually get a lower monthly rate? Husband is on G. Okay, well, there is a product called a high deductible G. Premium is certainly lower. And what that means is that Medicare pays, but your supplemental plan high deductible G will not pay until you've paid that high deductible. And this year it's right around $2,900. So again, Medicare pays, then all the other gaps you're responsible for up to that deductible, $2,900, and then your G would start kicking in. The negative about the high G, folks, is that if you stay on that plan, 2, 3, 4 years or whatever, want to get off of it, you can't get off without medically qualifying. So I'm not a real fan of high Gs. I know the premium's lower, and if that's what you have to do, budget-wise, then go ahead and do that. But you got to meet the deductible. Going to have to qualify typically to get off of those if you stay on them for a while. Okay, next. I had Part D through Cigna. They no longer cover Johnson County. I don't take any medications. Blue Medicare Essential doesn't change anything. Is this real? It is. In fact, yeah, for sure. And when she said Johnson County, this is someone local in our area, Johnson County, Kansas. Yeah, Blue Cross Blue Shield has two plans that are very low cost in this area this year. One is 0 premium, one is 70 cents. And so it is for real. Yeah, so no problem. Now, what I would do to go on that plan is I would go to Medicare.gov, and you'll see they're in there. Now, you want to be sure that you put you don't take any meds, so that's good. I'd enroll in that plan for sure. Do the 0 plan. Go to Medicare.gov, type in your zip code, tell them you're looking for a drug plan, and you'll see it'll come right up, and you can enroll in that plan. Take you 10 minutes. Very, very simple. It is for real. Keep going. All right, my company benefit claim to be using a C and D supplement for retirees. How does a C plan compare to a G? Okay, yeah. Yeah, I think what's going on here is that your company, C plan is actually an Advantage plan with an embedded prescription drug plan. That's not a supplemental plan. Now, by the way, there are C and D supplemental plans. But C plans you can't even touch today. No one writes them at all. And the D supplemental plans are very difficult to find. Most insurance companies don't offer those. So I'm almost sure what they're offering you is an Advantage plan. That's the C plan, the replacement plan. And the D plan is embedded drug plan. So how does an Advantage plan compare to a G plan? What I want you to do truly, because that's a loaded question. So here's what I'm going to ask you to do. Go to our homepage, MedicareSchool.com. MedicareSchool.com. On the homepage, there's a place there for you to click on a workshop. It's an essentials workshop. I do it. It's 50 minutes. You'll learn so much. But again, please, your terminology, and I know you're probably new to this, but truly, they're not offering you a supplemental plan C or supplemental plan D. That's an Advantage C and a drug plan embedded. Trust me, that's what's going on. And so you need to learn the difference between the supplemental system and the Medicare Advantage system. That's what you need to understand. And then decide if you want to be covered by Advantage with this retirement plan, or you want to get out of that and go into a supplemental plan. And that my workshop will teach you that. Okay. What else? Is it better for a spouse to wait until for retirement age, or is 62 okay to take spousal Social Security? Well, number one, if you're taking spousal, you're still subject to the earnings test. So if that spouse is still working, you can only make $23,400 and not be affected by the earnings test. So that's number one. Are we still working? Number two, the penalty is very, very steep. It's not the normal penalty we pay on survivor and retirement benefits. Okay, it's steeper. The first 3 years, it's 9 3/8%. I'm pretty sure that's right. Or 9.375% reduction. Years 1, 2, and 3, and then 2 more years because 62, and then it's 5% after that. So you're talking about what, 9, 18, 27? You're talking about a 38% decrease, and that's a lot on spousal. And remember, the spouse is eligible for 50% of what your full retirement age is. Okay, whether you take that or not doesn't matter. It's tied to your full retirement age benefit. So the most they can get is 50% of that, less reduction for taking early. So if you have to have the money, do it. But if not, I certainly wouldn't. It's just such a steep penalty. So you're getting 38% of 50%. No, that's not true. That's not true. You're getting a 50% reduction first, and then you're going to get a 38% reduction after that. So you're actually getting 62% of 50%. All right. So only if you needed the money would I do that, Julie. Here we go. Can I be on my wife's company plan and enroll in A&B before my 65th birthday in April 2026? Okay. Yeah, it's fine. But here's the thing. If your wife is going to keep working and has a good plan, then I wouldn't enroll in A and B. Now, if it's a mediocre plan or she's going to retire and you don't have that as an option, then it's fine to do what you're suggesting. Now, A and B is not going to go into effect until April 2026. Another issue is if you take A and B and you're covered by her plan and there's more than 20 employees on the payroll, her company plan pays first, A and B pays second, and you just paid next year, B is going to be at least $206.50. So there's a lot more to this situation that you need to realize before jumping into an enrollment. Please call us, and we'll coach you through your situation here. But yeah, you could do it, but you may not want to do anything. If you have a good group plan on your wife and there's 20 or more employees, you don't have to take Medicare at all. If you have an HSA, you don't want anything. If you don't have an HSA, you may want to take A only. But you need to do some research first and call us or someone that knows what they're doing, and we'll coach you through this to tell you what we would do if we were in your situation. All right. Had B and canceled and starting again. Do I still have 6 months to get this up? Yes, you do. So, Jennifer, what happens when you had B and canceled, they will reset the B date. And then you can get a supplemental plan. Now, I will tell you this. There is one carrier that I know of that will ask you if this is the second time you've had B. But I only know of one carrier that does that. Most carriers don't care. They're going to let you reset the clock and have that 6 months of that new B date. Okay? So that's the way it works. If you're in a birthday rule state, can you switch from a high deductible G to an N plan without underwriting? No, you can't. High birthday rule states, you can go like to like or like to less. So if you have a high G, you'd be going up to an N. You cannot do that. Now, there are some states that is just like to like. So G to G, N to N, not G to G, G or N to N. Makes sense. So most are like to less. But there are a few that are like to like. Missouri's like to like. I think pretty sure Louisiana. No. Anyway, so but I know you can't do this. You have a high G, you'd be moving up. Can't do that without underwriting. No way. Is that it? All right, folks. Hey, thanks so much for watching. I enjoyed being with you. And by the way, we do this every Monday, 5 o'clock Central Time, and every Thursday, 5 o'clock Central Time, unless I have some kind of major conflict or out of town or something. So join us. We love doing this, and we want to teach people. And if you have never subscribed to our YouTube channel, please do. We'd love to have you be a subscriber. We'll reach out to you every time we get a piece of content posted, which is 2 times a week. Normally we have new content, keep you up to date. So subscribe to our channel and stay in touch, and we'll just keep teaching you and helping you to make good Medicare decisions. Thanks so much.